Did you know that your body may already be warning you about poor circulation, and you're just not seeing the signs? If you're a man over 60 and you've noticed your morning erections have faded, or they're gone entirely, that's not just aging. That's your blood flow talking, and you need to listen. I'm Dr. Justin Keller. I'm a board-certified urologist, and in this video, I'm going to show you a simple technique you can do at home that targets 3 specific pressure points on your manhood, and how that can help restore blood flow, improve sensitivity, and bring back the natural signals your body used to give you every single morning. We'll talk about the real reason blood flow drops after 60, the 3 exact points to press, step by step, what kind of results to expect, and what most men get wrong, and how food, breathwork, and daily movement support this process without a single. This isn't hype. It's not theory. It's science. And I want you to watch until the very end, because the first pressure point I'll show you is the most surprising and the one most men have never heard of. Before we start, let me know where you're watching from. Drop your city in the comments. I read everyone. And if this topic matters to you or someone you love, please like this video and subscribe to Glowing Age. It helps me share these lessons with more men who deserve real, respectful answers. Let's begin. The quiet crisis no one talks about. Have you ever woken up, looked down, and thought, "What happened to me?" You're not alone. Every week I speak to men in their 60s, 70s, even 80s who quietly ask the same question. Their voice lowers, their shoulders sink a little, and they say, "Doc, I just don't feel like myself anymore." It's not about vanity. It's not even about sex, not entirely. It's about something deeper. Your sense of self, your vitality, your confidence. When morning erections start to fade or disappear altogether, it can feel like your body is slowly turning off a light you didn't give permission to dim. And yet almost no one talks about it. Most men keep silent. You were raised to be tough, to endure. And so you carry the quiet embarrassment alone. But here's what you need to know: it's not your fault, and it's not irreversible. I'm Dr. Justin Keller, a board-certified urologist. And what you're experiencing is a biological shift that happens to nearly every man past 60. We call it vascular erectile dysfunction, but that's just the technical term. What's really happening is a decline in blood flow, not just in your manhood, but in the network of vessels that fuel your entire pelvic region. Why does this happen? After 60, your body produces less nitric oxide, a molecule that tells blood vessels to relax and open. When that drops, your circulation becomes sluggish. Combine that with years of sitting, possible weight gain, cholesterol buildup, or medications for blood pressure or diabetes, and the vessels in your groin, already among the smallest in your body, begin to narrow. Less flow, less pressure, weaker function. It's that simple. But the emotional weight of that is anything but simple. Men tell me they feel invisible, like they've crossed a threshold into something quiet, lonely, and slow. Morning erections, what we in medicine consider a vital sign of male health, begin to vanish. And with them, a piece of identity starts to feel lost. But here's what I want you to know. Morning erections aren't just about intimacy. They're a signal, like a canary in a coal mine, telling us that your cardiovascular system is working well. When they decline, it's often the first sign of something deeper. Early heart disease, endothelial dysfunction, even insulin resistance. That's why I say this isn't a performance problem. It's a circulation problem, a health problem. And yet the good news is this: your body is still listening. Your blood vessels can adapt. Your tissue still responds. Even in your 60s, 70s, and beyond, your system has plasticity, the ability to heal, reroute, and recover. But you need to stop suffering in silence. You need to stop thinking this is just how aging goes. Because it doesn't have to be. In a few moments, I'm going to show you a simple, non-invasive technique that activates blood flow using 3 pressure points. But before that, understand this. Restoring circulation in the groin isn't about gimmicks or pills. It starts with awareness, knowing that what you're experiencing isn't weakness. It's a wake-up call. And like any good doctor, I'm not here to sell you a fantasy. I'm here to tell you what the science says. And the science says you can get better. Not overnight, but consistently. Naturally, with knowledge and small daily action. You don't need to chase your youth. You need to nourish what you have right now. And it begins by acknowledging the problem, without shame, without silence. Because you are not alone, and your story is far from over. Why blood flow declines after 60. Let's talk about what's really going on inside your body as you age. Why blood flow to your manhood slows down, and why those changes often begin without warning. First, understand this. Erections are vascular events. They don't start in your mind, they start in your blood vessels. For an erection to occur, your arteries must open wide and allow blood to surge into the sponge-like tissue of the penis. It's pressure, not muscle, that creates firmness. And pressure depends entirely on healthy, responsive blood vessels. Now, after 60, several silent changes begin to affect that process. The most important is a decline in nitric oxide production. Nitric oxide is a molecule your body produces to tell blood vessels to relax and expand. Think of it as your body's natural flow enhancer. When nitric oxide drops, and it does steadily after age 50, your vessels stiffen. They don't open as easily. Blood doesn't move as quickly. Less pressure, less performance. Second, we see damage to the endothelium, the thin inner lining of your blood vessels. The endothelium is sensitive. Years of high blood pressure, poor diet, lack of movement, even stress hormones like cortisol slowly wear it down. When the endothelium is inflamed or scarred, it can't produce nitric oxide effectively. It becomes rigid. And the smaller the blood vessel, the more sensitive it is to this damage. Here's the kicker. The penile arteries are among the smallest in your body, about 1 to 2 millimeters wide. Compare that to the coronary arteries in your heart, which are 3 to 4 millimeters wide. This means signs of dysfunction show up there first. That's why a weakening in your morning erections can be an early warning sign of broader vascular disease, even before chest pain appears. Then there's the role of testosterone. As you age, testosterone levels naturally decline, about 1% per year after 30. Lower testosterone affects more than libido. It impacts blood vessel elasticity, red blood cell production, and overall circulation. So it's not just about desire. It's about the physical ability of your body to deliver blood to where it needs to go. And finally, let's talk about muscle loss and inactivity. A sedentary lifestyle, which becomes more common with age, leads to weakening of the pelvic floor muscles, the very muscles that support erectile strength and bladder control. When those muscles weaken, blood flow becomes less efficient. Combine that with sitting for long periods, compressing arteries and lymph nodes in the groin, and the problem compounds. So, to recap, reduced nitric oxide, endothelial damage, falling testosterone, and pelvic inactivity all converge after 60. Add in medications, like beta blockers or antidepressants, and you've got a perfect storm for reduced circulation. But here's what's important. These are not irreversible changes. They are biological trends, not sentences, and they respond incredibly well to targeted action. I've seen men in their 60s, even 70s, restore healthy function by supporting their blood vessels naturally through simple daily habits, focused movement, and techniques I'll show you shortly. The biggest danger? Believing this is just normal aging. That belief keeps men stuck, quiet, and frustrated. But blood flow is something you can influence. And when you do, you don't just improve your erections, you improve your heart, your brain, your energy, and your entire quality of life. Remember, it's not about getting back to who you were at 25. It's about becoming strong in who you are now. Aging doesn't shut the door on vitality. It just asks you to open it in new ways. And that's exactly what we're going to do next. The power of pressure, ancient wisdom meets modern science. Now that you understand why blood flow declines after 60, let's talk about something most doctors won't mention, but should. How touch, pressure, and intentional stimulation in the right areas can restore that flow. Not through pharmaceuticals, not through invasive procedures, but through techniques your own body responds to deeply, naturally, and often within days. This is where ancient wisdom meets modern urology. For centuries, traditional Chinese medicine, Ayurvedic healing, and Japanese shiatsu therapy have used pressure points, specific zones along the body where nerves, vessels, and energy lines converge. In modern science, we understand that these are neurovascular junctions, places where pressing, stimulating, or massaging tissue can activate blood flow, nerve signaling, and hormonal response. What's remarkable is that we now have clinical evidence to support what healers have known for thousands of years. Recent studies using imaging and Doppler ultrasound have shown that certain points in the pelvic region can significantly increase local circulation and even trigger parasympathetic nervous system activation, which is key for erections, relaxation, and recovery. Let's break that down. Your body operates on two main nervous system settings: fight or flight, sympathetic, and rest and restore, parasympathetic. Erections don't happen in fight or flight. They happen when your body feels safe, relaxed, and grounded. The parasympathetic mode. Certain pressure points, when gently stimulated, calm the nervous system, reduce inflammation, and promote pelvic blood flow, all of which are crucial for regaining morning erections and full-body vitality. And yes, these techniques can be done at home. They're discreet, simple, and require no equipment. What they do require is consistency and respect for your own body's capacity to heal. Many of my older patients are surprised at how well their tissues still respond when given the right input. I had one gentleman, 72, who was on the verge of giving up. He had tried medications. He had tried supplements. Nothing worked. We introduced these pressure techniques, combined with light breathing and pelvic floor engagement, and within 2 weeks he reported not only stronger morning erections, but also better sleep, less urgency with urination, and a renewed sense of confidence. This isn't magic, it's mechanics. Your vascular system, your nerves, your breath, all working together again. Now, to be clear, this is not a cure-all. If you're dealing with advanced vascular disease or severe neuropathy, these tools may be supportive but not sufficient on their own. But for the majority of men in their 60s and beyond, what I'm about to show you is one of the simplest, safest, and most empowering ways to begin rebuilding blood flow where it matters most. In just a moment, I'll guide you through 3 specific points on your body. Not invasive, not painful, but incredibly effective when done daily. Think of it like watering a garden. You're reminding the roots that they're still alive. Before we move into the demonstration, remember this: your manhood is not just about function. It's a reflection of overall health, resilience, and internal vitality. When you activate these points, you're not just chasing a physical outcome. You're reclaiming a part of yourself that might have gone quiet, but never disappeared. Let's get into the technique. The 3 magic points to press, step-by-step guide. Now let's walk through the 3 key pressure points I use in clinical settings, and that you can use safely from the privacy of your own home, to stimulate blood flow, relax pelvic tension, and support healthy morning erections. These aren't just random spots. They are neurovascular junctions, places where blood vessels, nerves, and connective tissues intersect. By applying gentle, sustained pressure, you're signaling your body to redirect circulation, release muscular tightness, and restore nervous system balance in the pelvic region. Let's begin. Point 1. The inner thigh root femoral triangle. This is one of the most important pressure zones for men. It sits in the upper inner thigh, right where your leg meets your torso. If you place your fingers just below your groin, near the crease where your thigh folds when sitting, and move inward about an inch or 2, you'll feel a soft, slightly tender area. That's your femoral triangle, a major intersection of arteries and lymph nodes. Here's how to stimulate it. Sit or lie in a relaxed position. With 2 or 3 fingers, gently press inward and upward into that soft area. Use circular motion or steady pressure, whatever feels more comfortable. Breathe slowly. In through the nose, out through the mouth. Hold for 30-60 seconds on each side. This point helps open the femoral artery, encouraging blood to flow more freely into the lower pelvis. Many men report a subtle warming or tingling sensation in the groin within minutes. That's a good sign. It means your circulation is responding. Point 2. The perineum between the anus and scrotum. This is a foundational point in both Eastern and Western medicine. Located midway between the anus and the base of the scrotum, this zone directly influences the pelvic floor muscles and is tied to your body's erection reflex. Stimulating this area activates the bulbocavernosus and ischiocavernosus muscles, 2 key muscles involved in sustaining an erection by trapping blood inside the penile chambers. To stimulate this point, sit on a firm cushion or edge of a chair so your perineum is gently supported. Lean slightly forward to apply natural pressure. For targeted activation, you can use a soft rubber ball, like a lacrosse ball, or even your fingers if lying down. Apply steady, firm but comfortable pressure for 1-2 minutes while breathing deeply. Over time, regular stimulation here can help retrain your pelvic floor to engage more actively, which improves both erectile response and bladder control. Point 3. Lower abdomen just above the pubic bone. This point is often overlooked, but it's essential. Place your fingers about 2 inches above the base of your penis, just above the pubic bone. This area overlies the hypogastric plexus, a dense web of nerves that regulates blood flow, prostate health, and sexual function. Here's what to do. Lie down comfortably. With relaxed hands, press gently into the lower abdomen using a soft circular motion. Focus on relaxing the lower belly as you breathe deeply. Apply light to moderate pressure for 1-2 minutes. This point helps reduce pelvic congestion, a common issue in older men, and supports healthier blood vessel tone. It also encourages lymphatic drainage, which can reduce inflammation and ease tension in the bladder and prostate area. Best time to apply these techniques: right before bed, to promote overnight blood flow and relaxation. First thing in the morning, to stimulate circulation. After a warm shower or bath, when muscles are relaxed and blood vessels are open. During meditation or breathwork routines. Important notes: this is not about force. It's about presence, consistency, and breath. You don't need to push hard, just firm enough to feel contact without pain. If you experience numbness, sharp pain, or worsening symptoms, stop and consult a physician. Combine this with light stretching, hydration, and walking for best results. Many of my patients say that within a week of daily practice, they feel warmer in the pelvis, more connected to their bodies, and begin noticing subtle signs of renewed function, especially in the morning. You're not trying to force change. You're inviting it. And the body, especially at this stage in life, often just needs a little reminder that it still knows what to do. What to expect, realistic results, and common mistakes. Now that you know the 3 pressure points and how to apply them correctly, let's set some realistic expectations. Because one of the biggest frustrations I see in men over 60 is thinking this is a quick fix. It's not, but it is a proven, practical tool that can deliver meaningful change if you approach it the right way. Here's what I tell my patients: don't look for fireworks on day 1. Look for small signs that your body is waking back up. Most men who practice these techniques daily, combined with deep breathing and simple pelvic movement, begin to notice subtle changes within 5 to 7 days. That might mean a slight sense of warmth or fullness in the groin when waking up, a soft morning erection beginning to return, even briefly, less urgency or frequency with nighttime urination, better control over bladder muscles during the day, a shift in energy, feeling more grounded, less anxious, more aware of your lower body. These may seem small, but they're not. They're your body responding, telling you that blood is flowing again, that nerves are firing, and that the systems you thought were asleep aren't. They've just been neglected. Over time, think 3 to 6 weeks with consistent practice. That early signal often strengthens. Erections may become firmer, spontaneity returns, confidence improves, and even men who have felt disconnected for years start to feel more plugged in to their own bodies again. But this only happens if you avoid the common mistakes I've seen too many men fall into. Let's go over them. Mistake 1: too much pressure too fast. This isn't a massage contest. Applying force doesn't accelerate results, it often inhibits them. These tissues are sensitive. Nerves and vessels respond best to gentle, sustained stimulation, not forceful digging. If you feel pain, you're doing too much. Mistake 2: inconsistency. Doing this once or twice won't change anything. Your body thrives on repetition. Set aside 5-10 minutes a day. Make it part of your nightly wind down or morning routine. Treat it like brushing your teeth. Small, daily actions compound over time. Mistake 3: ignoring your breath. Your nervous system drives circulation. If you're tense, rushed, or distracted, you'll stay in sympathetic fight or flight mode. Erections don't happen there. Breathe deeply through your nose, exhale slowly through your mouth. Let your entire body soften. Mistake 4: skipping movement. Pressure points are powerful, but they're not magic on their own. You must support them with gentle movement. Even a daily 15-minute walk, light hip stretches, or pelvic tilts can help maintain the blood flow you're stimulating. Mistake 5: expecting youth instead of progress. This isn't about becoming 25 again. It's about becoming stronger and more connected at 65, 70, or 80. Comparing yourself to who you were decades ago will only create frustration. Instead, compare yourself to yesterday. Did you feel more warmth? More presence? Better sleep? That is progress. Remember, your body is not broken, it's just been quiet. And quiet doesn't mean gone, it means waiting. The men who get results from this work are the ones who listen. They respect the process. They don't rush it, they support it with care, curiosity, and consistency. And those men, they often come back to my office with a look in their eyes I haven't seen in years, a quiet confidence, a spark. Not because of me, but because they took ownership of their health and their healing. Next, I'll show you how to support these techniques naturally, with food, herbs, movement, and breathwork, to create lasting change from the inside out. Stay with me, we're building something strong here. Supporting the process naturally, bonus tips. You've learned the pressure points, how to use them, and what to expect. Now let's talk about how to support this process from the inside out. Because real, lasting improvement doesn't come from one direction. It comes from the whole system working together. Here's what I tell every man I work with. If you're stimulating blood flow externally, you need to fuel and protect it internally. That means focusing on 4 key areas: nutrition, movement, breath, and natural support. Let's start with nutrition, because what you eat directly affects your circulation. Your blood vessels are made of living tissue. They need support to stay flexible and responsive. If your arteries are inflamed or coated with plaque, even the best pressure technique won't reach its full potential. Here are the foods I recommend to men over 60 who want better blood flow and stronger erections, without medication. Beets rich in nitrates, which convert into nitric oxide in the body. These help dilate blood vessels. Try fresh beet juice, roasted beets, or beet powder in smoothies. Pomegranate, powerful antioxidant that protects the lining of your arteries and boosts nitric oxide availability. Leafy greens, spinach, arugula, kale. High in nitrates and magnesium, essential for vascular relaxation. Dark chocolate in moderation. Contains flavonoids that support endothelial health. Aim for 70% cocoa or higher. Fatty fish, salmon, mackerel, sardines. Omega-3s help reduce inflammation and keep arteries flexible. Nuts and seeds, especially walnuts and pumpkin seeds, which support testosterone and circulation. Limit processed sugars, excessive alcohol, and heavy saturated fats. These foods stiffen your arteries, raise blood pressure, and slow recovery. Next is movement. You don't need a gym membership or intense cardio, but you do need daily motion. Blood flow requires muscle activity. Your pelvis is a dynamic structure, not just a place you sit on. Here are simple movements that boost pelvic blood flow. Walking, just 20-30 minutes a day, helps circulate blood, move lymph, and oxygenate tissues. Pelvic tilts, lying on your back with knees bent, gently tilt your pelvis forward and back. This activates deep pelvic muscles that support erections. Kegel exercises, yes, men can and should do them. Tighten the muscles you'd use to stop urinating midstream, hold for a few seconds, then release. Start with 10 reps, twice a day. Gentle hip stretches, loosening the hip flexors and lower back reduces tension on blood vessels running through the groin. Breathwork is another tool I give to nearly every patient. Why? Because deep breathing switches your nervous system from fight or flight into rest and restore. And that's when erections happen. Here's a simple technique. Sit or lie down comfortably. Inhale slowly through your nose for 4 seconds. Hold the breath for 2-3 seconds. Exhale slowly through your mouth for 8 seconds. Repeat for 10 minutes. Do this before bed or after your pressure point routine. It calms the system and enhances blood vessel responsiveness. Finally, let's touch on natural supplements, if your doctor approves. I don't overprescribe supplements, but here are a few that have real science behind them. L-arginine, an amino acid that helps the body produce nitric oxide, often combined with pycnogenol for better effect. Panax ginseng, shown to improve erectile function and energy in several clinical trials. Maca root, traditionally used to support libido and stamina. Citrulline, like arginine, it supports nitric oxide production but is often better tolerated. Remember, supplements support, they don't substitute. They work best when combined with everything we've discussed: pressure points, food, movement, breath. Most importantly, approach all of this not as a temporary fix, but as a new relationship with your body. Your 60s and 70s aren't a decline, they're a reset. Your body is different now. It needs different tools, but it still responds, it still heals. And it still wants to serve you fully, faithfully, and powerfully. The tools are in your hands now. Use them with patience, use them with trust, and give your body the chance to glow again, quietly but fully. If you've made it this far, then you've already done something most men don't. You took a real step toward understanding your body and how to work with it, not against it. Remember, you're not broken, you're just changing. And change means your body needs a new kind of support: gentle, smart, and consistent. Those 3 pressure points, they're not magic, but they are powerful. And when you combine them with better habits, like clean foods, focused breath, and simple movement, you give your body the best chance to respond. Not like it did at 25, but like it can at 65, 70, or beyond. If this helped you, pass it on, share it with a friend. Leave a comment and let me know how you're feeling after trying the routine. And don't forget, like this video and subscribe to Glowing Age. It helps me keep showing up for men like you, quietly strong, quietly ready to glow again. Take care of yourself. Your story isn't over. It's just entering a better chapter.